Dr. Shaun Astorga is a board-certified physical therapist who has overcome his own chronic
Welcome
pain
to the Athletic
from a brain and neck
Podcast.
injury after being written off by other medical professionals. His first-hand experience managing his own chronic pain gives him a unique sense of empathy and compassion to his patients, which is exemplified through the quality. Well, Shaun, welcome to the show. I really appreciate you carving the time to be here. I'm a huge fan of yours. I love your content. I really love the direction you guys are going. I know we talked about this a little bit off air, so just appreciate you so much for carving the time to be here. But for people who are not familiar with you, why don't you start by telling us a little bit about yourself? And this can be as broad or as narrow as you want. So if you want to give the origin story version, I'm here for it. If you just want to kind of bring us up to speed with what you're doing today, that's cool too.
Yeah, awesome, man. First, Ryan, thank you for having me on. I really appreciate it. So like I said, my name's Shaun Astorga. I'm a former finance guy turned physical therapist. I founded a physical therapy practice called Amp Performance Rehab in northern New Jersey, which I co-own with my friend Monica Moore, where we help like a pretty motivated and active population of people, including athletes of all levels, a lot of Gen Pop. It's really people who just like doing cool shit with their body and they don't want to be limited by pain. I also own a continuing education company. It's called AMP Education. Our main offering is our mentorship program, which is called the AMP Blueprint. This is a 12-week, it's an online program where we kind of lay out the framework that we use in our practice, from the underlying principles all the way through practical implementation and application, with the goal of really helping other practitioners, clinicians, fitness professionals, just better help their clients achieve their goals, right? Just get better at our skill set so we can better help other people. I don't know what else to say, man. I mean, I guess it's important for people to understand, some of my biases. I suffered a major injury in 2017. It was a brain injury and an upper cervical injury. And that was really kind of the catalyst for a lot of the things that I do and believe today. So founding our PT practice and then starting our mentorship program. A lot of the continuing education that I have taken up to this point has really been me trying to figure out my own situation and understand my own situation, because I wasn't able to find the help that I was looking for. And while I acknowledge that I don't have all the answers, I have been able to put a lot of things together in a way that's very, very pragmatic. So I hope that I can just offer some valuable insights for your listeners, man. I'm an open book too, so any questions you have, man, I'm all for it.
Yeah, that's an awesome. If it's not too heavy, man, I'd like you to unpack that injury just a little bit more. Tell me about what happened and just kind of the recovery process, and especially for a lot of the clinicians that I look to, there seems to be in their recovery process there was this kind of stopping point of just unable to get to the other side of some issue, whether, it's an orthopedic issue, they're just not getting the treatment that they feel is necessary, or in your case, a brain injury, which I know absolutely nothing about, but I'd love for you to unpack this a little bit more.
Yeah, for sure, man. And I agree 100%. Like, that's been my experience with a lot of people that I work with, like from the mentorship side of things, is they have similar background injuries that weren't getting better or whatever it might be. Mm-hmm. So yeah, kind of like a trial by fire is, you get thrown in it. But yeah, essentially what happened was I was at work and literally just closed the cabinet door, and two pretty heavy boxes, they fell and they hit me in the back of the head while I was looking downward. And it was an upper cervical injury, and then it was a concussion. And things just did not heal like you would typically expect. It was a work-related injury, so there is a lot of red tape around that, going through like the workers' comp system. It's very driven by people who are non-medical professionals, we'll say, and is really not an efficient system from the patient's perspective, But so the reason I say that is because it took some time for me to get to the people that I needed to get to, and had to really advocate for myself in that sense. But things weren't really healing appropriately. And a lot of the emphasis, because it was a work-related injury, was not on me and the goals that I was trying to get back to. I'm a runner. At the time, I played basketball. I'm, afraid of some injuries now. I can't risk it, so I don't play anymore. But like, I was very super active. Like I always have been, like athlete my whole life, and no one cared about all that stuff. They just cared about, when can you go back to work? When can you go back to work? When can you go back to work? So I kind of got sent to a lot of different specialists, and no one can really explain the symptoms that I was having. I had a lot of, clinically, it'd be like a lot of signs of upper cervical instability. So think of like transverse ligament in your neck is not doing what it's supposed to. So I get like cranial nerve signs in my face. So a lot of like tingling, numbness in my face. These are like kind of scary signs, especially when right? Tingling, loss of not loss of function, but loss of strength in both of my arms, a lot of that kind of stuff. And it kind of persisted for a while. And one of the biggest issues that I had is that, specialist to specialist, like I said, is everyone was kind of managing me away from function, from activity, from things that were meaningful for me. And I started noticing a lot of, it's like psychological type issues from it, like a lot of getting depressed. Of course, you're not like with your friends, you're not able to do a lot of basic stuff, a lot of anxiety, anxiousness, like a lot of basic things. And it got to the point where like I couldn't like walk to my mailbox without getting heart palpitations, like crazy shit. Like this is not, we're like beyond the realm of like concussion at this point, right? And then one day I was just like listening to a Ben House on a podcast, and he was talking about something hormone related. I forget exactly what it was, but he was talking about TBI and people who had a long, trouble overcoming, concussion symptoms. So I just reached out to him and I was like, basically like, hey man, here's my situation. Do you think you can help? And what was interesting is he was the first person who kind of asked me like just basic shit. Like, what's the least you could do? Like, I know you can't exercise. What's the minimal amount of exercise you can do in the gym? How can we start introducing activity into your life? Like, tell me about like what you're eating and how that's affecting things. Tell me about like your sleep. Tell me about all this kind of stuff. And he got objective data from like labs, all that kind of stuff. And we started just implementing these very, very basic and simple things. I started noticing a lot of symptoms starting to improve. So that's kind of like the first 10 months of things. And then I got to a point where I could like function. I was back to work and doing a lot of those things, but I still had some kind of issues. I don't know how much more in depth you want me to go on those. I'm happy to keep going, man, but
yeah, man, I'm honestly, I'm kind of on the edge of my seat here. This is super intriguing to me.
Oh yeah, man, that was a cliffhanger I almost left you with. Yeah. So so I had a lot of just like weird kind of, I don't even know what to call them. Like, there were just like a lot of visually stimulated issues, a lot of like cranial type issues that were still going on. So, for example, I had a patient on a treadmill and I was trying to talk to them. Like just the physical, like the amplitude of their body going up and down, I'd have to look away because it would make me dizzy. So I started working with a neuro-optometrist, and I'm like prism lenses. So the goal with the base prism lenses that I had was to help increase kind of my peripheral awareness. Like when I put them on and took them off, I couldn't really tell anything was happening, but when I was walking around moving, I could definitely tell that there was a positive change. So I started noticing, okay, this is getting better. And then I started trying to progress my training, my how much can I get away with in the gym from a strength standpoint? Can I get back to running? At this point, I was still not able to jump, do any kind of plyo, any low-level plyo, highlight, like nothing. I couldn't, if I stepped off a curb weird, I'd get like a lot of pressure in the base of my skull. So a lot of like clinically, these are all very like upper cervical related issues. So I started working with my friend, Mike Camperini. I'm not sure if you're familiar with him. And he was, well, actually, I could go back a little bit. I actually went to the intensive during this time frame with Bill Hartman, and I got there a day early just to go through a session with him, get his thoughts on things at the time. And that was the first kind of situation that I started noticing improvements in the upper cervical symptoms. So we did basic stuff that I would do with patients, like nothing too crazy from that sense. But I was still limited. Like I couldn't objectively look at the situation myself. So that's when I started working with my friend, Mike Camperini, and he got me back to a point where I was able to start running, training, doing a lot of things. But I still needed support. So I needed support from literally like a broil and bite, like mouth guard type situation. And I don't know if you're familiar with like concussions at all and any of that kind of stuff, but like, the reason I went that route is just because, I thought about what we were focusing on, and a lot of it had to do with the relationship at my jaw, right, and my cranium and my upper cervical spine. So you can kind of artificially use like a mouth guard as almost like an orthotic to kind of help with that situation. So I could basically do everything with that in. Like I had no limitations. I could cut. Like I literally went one day not being able to like do any kind of change of direction stuff to now I can do change of direction stuff. So like kind of crazy shit. But at the same point, I was like, I need to like figure this out more because I do not want to have to rely on this mouth guard to literally go for a run down the street. Am I allowed to drop F-bombs? My bad. I don't.
Yeah.
Sorry, man. I'm just like going. Yeah. So that led me to another referral. My friend, I don't know if you know Rua Gilna.
I do not.
So he's like he's a strength coach. He's like in the PRI world. And he referred me to an airway dentist, Howard Hindon, who's fortunate for me. He's like only 30 minutes away. So last year I started working with him, and very interesting perspective because we focused on essentially like changing the structure of my lower jaw. This is where shit gets weird. So like I can already a little weird, but I'm like, I can get behind it. Changing the structure of the lower jaw a little bit. So basically expanding it a little. So I had noticed, and you look at pictures of me, like everything started kind of like converging inward over time. So there's definitely like an airway component to this. And that's kind of where we are. We did that. I have it in the final stages. I have Invisalign now to kind of get the teeth to support the structure now. And I have no issues. Like you see, I'm training for halves. So I'm doing everything I have to do. I do not think this journey is what everyone needs to go down, but I do think that like there is a lot of value in, me trying stuff and seeing where does this fit, right? Not everything's going to fit for everyone. Big rocks are always going to win kind of situation, but there are times for this kind of nuanced approach. And like being as a practitioner, like I find it very useful to at least have some insight on when those things are, might be valuable.
Shaun, this is really badass, man. Honestly, I mean,
I appreciate it.
I've only had intermittent episodes of pain, right? I broke my leg. It's a 6 to 8 week process. The bone fuses together. There's a big knot in it now. Nothing crazy. I've had some sciatica, driven by my own stupidity, trying to lift too heavy. It goes away. Something of this magnitude that takes, what are we at, 7 years now, is substantial. So I think it's really incredible the process you've gone through to get here. I'm sure this really helps you with your empathy in terms of your own practice in dealing with patients. But I want to dial into this last piece. I have a question about the airway dentist and the restructuring of the jaw. Is this driven by just braces? Are there other strategies to accomplish this task?
So I'm admittedly, well, first I appreciate you saying all that because it's definitely been a journey, and I don't want to paint the picture that it was straightforward and easy. So, but yeah, so this is not an area where I'm an expert by any stretch of the imagination, but I can tell you what we focused on. So the imaging is actually like, if you're nerdy, like it's really cool because you can see a lot of the, like the bony adaptations over time. So the differences in like the structure of the jaw, like the shape of the airway. If you're in my world, like you'll hear people talk about like concentric muscle orientation and compression. You can literally see it in my like the older photos, like the tongue concentrically oriented above the hyoid, so keeping the airway open. Like these things are very real. And then like, but like I can also see how people are like, this is batshit crazy. So it's just interesting to see that. And clinical signs you would see are people like they need to like gasp for air while they're talking, so they're like catching their breath as they're speaking. That's like airway is having a hard time staying open kind of stuff. But so anyway, what we focused on was first an appliance, like an orthotic. The goal of it, as I understand things, was to make sure I had molar contacts. So molar contacts, and this is again, I appreciate that this is like a little out there, is like getting heel contacts on the ground kind of situation. So getting molar contacts, but also changing the relationship between the mandible and the cranium. So for example, like a lot of people, when they have, especially upper cervical injuries, like they're going to create a lot of tension to provide like a sense of stability to that area is the easiest way I could think of it. And I think about my friend, when I started like getting back into training and I was deadlifting at the gym, Mike Baker like yelled across the gym. He was like, "How hard is that set for you?" And I'm like, "I don't know. It's like a 6 out of 10, like nothing crazy." And he's like, "Why are you looking like it's a 1 rep max?" I was literally clenching everything down. But that was kind of my resting position, right? Like I was trying to create a lot of tension through like top down. So it's really to change that relationship. So to protrude the mandible a little bit, to like quote unquote expand the posterior, like the cranium, like all that kind of stuff. And then once that was a period of time, I forget how long, 6 months, 9 months, something like that. We transitioned to what I have now, or basically like an Invisalign that's progressive. So get the teeth to change to support the structure. And that's where I'm at now. I'm like the last phase of that, where we're going to start taking these to a part-time situation where I just wear them at night and then see what happens kind of thing.
That's really exciting and interesting. I think I'm going to have some questions after the show for you about this, but
I hope I can
this
answer
is
them.
a,
Sorry, I didn't mean to cut you off. It's been a learning
no,
process
go
for me.
ahead.
This has been a very big learning process for me because I didn't have a hard time getting around it. Like I met the dentist. I'm like, I get what he's saying. He's like a down to earth person. He kind of like gets it big picture too, like what my goals are, and everything was geared towards my goal of running and the symptoms I had with running and all that kind of stuff. So I was very comfortable with the process, even though I didn't fully understand it. And then I saw the images. I'm like, oh, this is just fucking cool. I'm gonna ride this out for a little bit and see what happens. So
Yeah, absolutely. So if you're deep in the industry like we are, I think it's easy to get pegged as the advocate of the model, this compression expansion ideology. We're talking about bones moving. We're talking about shifting, the relationship of the mandible to the cranium. And for many people, especially coaches like myself who aren't trained clinically, this can be a real challenge. Um, However, I think from the perspective of the physics, compression and expansion are core concepts. They're irrefutable. But I think this bridging this gap into practice and seeing real changes on imaging, like you're talking about, is really where most people get stuck. So I want to be very clear. I'm not here to draw lines in the sand. I know people can get pretty hot about this from sound bites on social media, but I would love for you to start with this concept in terms of some of the big rocks that play into your assessment process or how you're approaching treatment with your clients.
yeah, for sure, man. And I do agree that there's like there's such a massive gap between like the theory and practice side of things, which I definitely have thoughts on, and I do think that like it's challenging. Like no joke. So you're working with humans and you're learning new stuff, and like there's a lot of things that kind of go into that. It might be helpful. Like I'm happy to give my big rock, like kind of how I view things. But something I tell everyone who joins our mentorship program might be helpful to hear because this has been kind of a guiding thing for me after going through
Take
it.
this where you want it, man. This is your
Yeah.
show.
Yeah. All right, let's go, man. Yeah. Well, the reason I say that is because, I don't think that it's fair for a person to try to be someone else. And I don't think you're setting yourself up for failure when you do that. And I've been guilty of that, right?
Mm-hmm.
Like when I start learning stuff, I'm like, oh my God, I got to learn like the exact algorithm and blah, 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 and all that kind of stuff. It's like, no, like we're all doing stuff now that helps people. Right. So like we've already, and this is like literally what I ask people in the first week of the mentorship program. It's like, who here's ever helped somebody get out of pain that someone else couldn't help them with? Who here's helped somebody lose weight who couldn't lose weight? Who here's helped put muscle mass, whatever, all these things. And everyone raises their hand because we've already done this stuff. Right. So we're not here to like learn how Shaun treats and emulate Shaun. We're here to like, I'll share with you whatever you want to know, but I'm here to make your process better. Right? Like how can we take information and bring it into what you're already doing and understand things from that perspective versus like try to emulate what you see on social media or emulate what I talk about or, Greg Hawthorne, who helps with the mentorship or Encore. Like we all do things a little differently, but from the same principles. So yeah, I know we talked about being overwhelmed. So when I think about my process, it's going to be like kind of underwhelming. I think of just like a general assessment is really to understand the limiters for the person. And I spend a lot of time understanding the person's story, like their motivations, their fears, their concerns, their goals, why they came to AMP versus somewhere else, history, like basically showing an interest that's above and beyond what you get in the medical system, but also it really helps me understand the things that like I'm going to be able to, the rocks that the levers we're going to be able to pull, I should say, that are going to help them kind of move in the right direction. We spend a lot of time up front before someone even steps in our doors. From there, it's like, what are the buckets that I care about? I think about education. So overcoming maladaptive beliefs, maybe, right? So for example, someone's been told their whole life, don't bend your spine. And now they're coming to me with 10 years of extension-based low back pain because they've never bent their spine. So like that's a belief that we have to overcome. I can do all the cool breathing shit. I can do the cool plyos, all that stuff. But if we can't get the mental hurdle out of the way, like we're probably going to be, 2 steps forward, 1 step back kind of situation. This also helps the education side is setting expectations for the plan of care, right? So making sure they understand what we talked about. Like, Ryan, when you go home, what are you going to tell your wife we're going to be working on in PT? Like something as simple as that, just to get a good idea of like where their head's at and what they're taking away from the session. The second bucket that we have is it's kind of related, but it's behavior change, right? So an example, especially in my world, like the running world, is like sometimes people just like don't help themselves. Like they're just like consistently overdoing it, right? And that's very common. I just told you about my running. Like I thought I was doing my slow, easy runs at an easy pace, and my coach was like, "No, bro, you got to slow it down more." Like that's a very real thing. So it's like understanding that why do you feel the need to keep pushing when things are easy? Like maybe they just don't understand the goal, or maybe there's some other underlying motivator for that. So like that's the behavior change component that is like a central tenet for what we kind of care about. The next bucket would be range of motion. This is a kind of group it in two different ways. One is kind of your relative motion. People talk about on, like social media, like literally you're in isolation. What does your joint motion tell me? That is really, can they get into the positions they need to? Yes, but it also gives me an idea of center of mass. So like how they're managing all of the stuff they've told me about in their story, like the life stressors, physical stress, all that kind of stuff. The next bucket would be like more of I guess you can call this like coordination, but I put it in the active range of motion section. Like, what does it look like when you do a body weight squat, a split squat, a lunge? When we get more dynamic, what does it look like? Can you demonstrate like I'll use this word loosely, like competency in a body weight squat, but then we start adding a more dynamic component and it just like goes to shit. Like, okay, maybe that's something we need to work on. Next bucket would be like force production that's relevant for the person, capacity. And I'm saying these things like buckets, they're not like we do one and then go to the next. They're kind of like always happening. It's like, what's the biggest driver here? That's kind of like the way I think about things from like a straightforward standpoint. Overarching theme is always going to be graded exposure. Like literally what's the entry point where we can challenge this person enough that motor learning happens, motor learning takes place, but it's not too much where it's like they're going to go home and not be able to replicate it in a meaningful way, or it's not too much where it's like going too far away from the goal. If I have to cue a person 100 times, probably shitty exercise for them at the moment, right? But if one cue, like they focus on one thing and we get good at that, cool, like that kind of thing. Those are like the general way I think about things, and then how I present it to a patient is going to be like where the nuance comes in. It kind of depends on the person a little bit.
Okay, so one of the biggest accusations for this model, this perspective, and I don't mean yours specifically, people on the outside looking in at this compression expansion, is not that something is too challenging for people, but that maybe we're not driving enough intensity. They think that the end result is going to be these sideline drills where we're trying to like woo-saw our way back to performance and movement competency. Can you riff on that a little bit? Because I think it deserves to be unpacked. One, I know you're not just having everybody just stretch, reach, do all these things, but I also know you're not going too far on the other end where, we just disregard this. To me, it's a big pendulum that swings back and forth, and coaches, clinicians, we get exposure to this information, whether it's PRI, and we go so far one direction that we lose a training effect. And then we become frustrated with it because it's not working the way we want, or we're executing it poorly, or maybe there's a gap in our understanding. And so we swing back to the other side, and now it's like, whatever, just move, it's fine. So, I mean, I'd love for you to just kind of walk me through this oscillation and making sure that things are actually appropriate for the client in front of you.
Yeah, for sure. I put a lot of the breathing stuff, and I don't know if this is accurate or not, but I think about it very much on the like recovery side of things. Mm-hmm. So the goal isn't for me ever, like if I'm doing that with someone, it has literally nothing to do with hypertrophy, strength, or like nothing, right? Once people start saying that, I'm like, all right, we're talking about different things at this point. So the reason I'm going to do something like on the breathing drill side of thing is to restore, I don't know what terms people are comfortable with, like adaptability to the system, give them more movement options, relative motion between joints, reduce the influence of like superficial muscle activity on the skeleton, like all of these things. Like, and it comes to a movement principle. This is like straight from Bill Hartman. Is like, he talks about we need a gradient for movement to happen, meaning we need to be able to shift pressure from side to side. So think of athletic movement. We need to load to propel. We need to like go into the cut to get out of the cut, like all that kind of stuff. So it's like, I don't think there's like an optimal way for a person to do that. And I don't think that like more motion is necessarily better, but like you need enough where the person can feel good. And there's like a little bit of a gray to that. With those, like the KPI that I'm usually using is something that is relevant to the patient. We call it an asterisk sign in the PT world. So it's like, when I squat, my knee hurts. Like, okay, we can use that as like, okay, like Ryan, we just did a squat, your knee hurt. We did some stuff. How does your knee feel when you squat now? It feels better or worse. Cool. I can make decisions based off of those things and then, kind of go from there. So I very much think of the breathing stuff on that side of the spectrum. I think that there's a place for it in early rehab, yes, but I also think about it from someone who comes in and works with you, like an athlete, and they train and they have a hard session. My expectation is that it's driving fatigue, which is like no shit, right? That's what we're doing. So there's going to be acute changes to the body. So if we're thinking about how can I set this person up for success, like from a recovery standpoint, like I would include that stuff in that realm of things, because now it's like, okay, there's some certain orientations that happen to this person's body. They lost some motion on their right side, whatever. Like we can do stuff to help mitigate any negative secondary consequences of that, set them up for success. Yes, still please sleep 8 hours a night, eat all the food, like all that kind of stuff. I'm not saying don't do big rock stuff, but like it fits in more on that side of things for me versus like we're going to start developing force production qualities. We're going to start retraining how you put force into the ground, like all that kind of stuff. So I think that distinction is like very important when we start talking about these things. And I do think some of the criticisms people have are very valid on this social media, just to the way things are presented. Like, I don't think the goal is to really turn every exercise into a breathing drill. I think that's missing the point, but what happens with the breathing drill is like you're restoring some kind of dynamics internally, right? So ability for pelvic floor, anterior pelvic floor to like contract and relax. I don't know however you want to call it. That's very related to like I don't know, like a plyo, right? Where you're like jumping up, right. You're getting, right? It's just a higher force production, aspect of things. So there's definitely like relationship from the principle standpoint, but I do think that they're separate goals. And I always try to think of things from the goal perspective.
So from a collaboration process, because I mean, obviously Monica is business partner. Justin is a performance coach, her husband. I know you guys have done some collaboration. I'm sure there are other coaches that your clients work with. So I want to speak from the perspective of an athlete whose primary goals are speed, power, strength, stamina. Like we want really high outputs. Obviously, you and I know that with these high outputs come a lot of concentric tone, right? We're trying to put force in the ground. We're trying to contract, squeeze, propel, just everything go, all gas, no brakes. On the other side, we know you do this a lot and you start to drop off relative motion. Athletes get tight, old school thinking, a lot of extensor tone, kind of standing like Batman, just yoked up. How are you working to, especially with these coaches, how are you collaborating to make sure that they're maintaining enough movement quality while also not minimizing the speed, power, strength, higher outputs that you're looking for?
Yeah, that's a great question. And I think a lot of this can be done through like the programming side of things. And again, I think of things from like always just like, what's the goal? Why do I have this block? Like, what am I doing in the power block? What am I doing in the strength block, the accessory, like all that kind of stuff. So I think that we can make a lot of headway from that perspective. So for me, it's actually Justin Moore would be such a great person to have this conversation with. He does it so well. Yeah. But a lot of it is like knowing, like, so take a breathing drill, right? One of the goals for me is like, can we get their foot contacts like within their base of support? So like the foot contacts are important because that's like how you're shifting pressure in your body. It's like when you're more heel heavy, your center of mass is a little further back. And then as it like slightly translates forward, right, where now we're turning to the other side, like all that kind of stuff. So it's like getting someone comfortable with that. And then how do we translate that to like multi-directional speed? Like it's the same cues, right? Like we need to find the inside edge of your foot or whatever it might be. Keep the goal the same from the intensity side. Like if you're like, you have like I don't know, like the strength block, like it's got to drive that adaptation. But then we have our accessory stuff. Like this is where we can maybe, reduce some of the intensity a little bit and focus on the position. So like an example would be, this is how I do it in my own training. It's literally like a safety squat bar, split squat, front foot elevated. And my goal is capacity in this position. Like, so I'm going to leave like 3 reps in reserve, like, all that kind of stuff. So I'm not driving too much from an intensity standpoint. And my goal is not that I'm going to get like crazy jacked with this exercise, but like I'm going to get better at doing this so I can keep my pump handle open longer. And my hope is that when I go and run, that it's going to translate to that in some capacity, right? Like that's literally how I think about things. So the way that we work with athletes, is going to kind of depend a little bit when we have this collaboration aspect of things. So depending on the person, we might take more of a leadership role in the beginning of rehab, and then the strength coach, like the pendulum is going to swing more in their direction as we kind of move along a little bit. We also have athletes that we work with where it's like, hey, we're prepping for the season and he's got this knee thing that popped up. Like let's just literally, like, what do you guys think from the medical standpoint? Is he safe? How can we change his movement prep? Are there things we should be doing in their programming that we can add in? And then we just literally just do it and see what happens.
Nice. Yeah, we see some young athletes come in who have quite significant ER orientation, right? Just butt clench, shoulders back. They're going through some of their tests and they're moving tough. But great athletes always seem to solve these movement problems, right? I think of sports, just like you got a problem and it needs a movement solution. And regardless of what we test them on the table, like they're figuring it out. They're going to score goals. They're going to hit nukes. Like they're going to steal bags. It's just the way it goes. But I also find that because they're young, they're active, they take care of themselves, they're hydrating well. They're pretty malleable. You can get them in and out of positions pretty rapidly. Has that been your experience in a lot of cases with some of these athletes?
Yeah, 100%. Yeah, and one of the things that we try to determine, clinically, but it would be the same situation, is that how quick can we get change in the person? Like how adaptable are they? Right, that's going to be part of the story and all that stuff. But when we do an intervention, how quickly do they change? Some of these athletes, you get them to cough a couple times and they feel their abs, and then it's just shit just moves better, and you're like, all right, cool. Like we probably don't have to spend too much time doing this kind of thing. Yeah, 100%.
Yeah. So Shaun, I do want to shift gears a little bit and kind of talk about some of the content that's online, right? There's always critics, and you've already mentioned that the criticism is fair. In my mind, the where we are in this conversation already, I'm thinking the more things change, the more they stay the same. The model, the perspective, the lens that you're using is really allowing you to just be precise with whatever interventions you're using. But at the end of the day, you're understanding this balance of how to get people in a place where they can do the activities they love and move, not perfectly, but well enough. Right. And I think back, gosh, I don't know how long, we're just a simple programming tactic from, the strength world is like, hey, we're going to do these bilateral lifts to drive more output, to drive more force, but we're going to do split squats and unilateral stuff to maintain some element of movement competency, like at a very simplified level. That's still this balance that we're trying to have. Right now, I've already addressed this too. You've been through a lot, so I know you're super open-minded. You're willing to have a conversation and chat with anybody, and I think dissent is really valuable for helping us come to some common ground. But as a sidebar, I think there's a lot of people who find it a lot easier to start a smear campaign rather than a conversation, which I don't totally understand. But I think what's happening is there's some friction for these people, right? So if you're listening and you're like, this compression, expansion, relative motion, it's all bullshit, this is for you. But either one, I think their beliefs are being challenged, or they're in stark disagreement, and the industry favorite, the writing reflex, they're shaking their fist at us, it is just activated. So would you care to talk a little bit about your own evolution with this, right? The first time you kind of took in this Bill Hartman or this expansion, compression, these thoughts, they're obviously different than what you were clinically trained on. However, you're still implementing a lot of foundational practices that you probably learned early on. So I would love to hear just how you kind of, work these thoughts and just kind of came to the place where you are now, where you have not a full, but a much more holistic understanding of how you're applying them.
Yeah, for sure, man. Yeah, this is an interesting topic. So I mentioned the head injury before. But there's actually another injury that got me into this world, which is relevant. So when I first started practicing as a PT, I was playing in a charity flag football tournament. I had hurt my back going into it. So
I like the story already.
Yeah, this is great. This is like when you realize you're getting a little old, maybe kind of thing. So we're playing in this charity flag football tournament, and I'm like, you see, I'm like pretty like laid back person, but when I play sports, I get a little fucking crazy. Like the switch turns on, right? So I'm lined up against the dude, and like I smoke him, and I was just underthrown. So I'm like, dude, this guy can't cover me. So like we're gonna do the same exact play, just throw it farther. And right when I pushed off, I hurt my back, pain down my leg, like crazy, just like it was just brutal. Like I couldn't straighten my leg, like scary, nervy type stuff. But anyway, so like I went to the on-staff person there. They're like, yeah, go see a neurosurgeon. I did not do that. But I went back to work, and I was basically getting treated, right? And nothing was making me better. And if you want like a good imagery, I was literally treating patients with a hot pack strapped to my back. So imagine you come in with back pain and I'm the guy who's going to treat you. Like that is a sight right there. You're like, okay, confidence in this guy. So anyway,
it's like the skinny cook, you know?
Yeah. Like I'm trusting this guy. I'm going to go to the bald barber kind of thing. So it's like, on a Saturday, I was seeing a different PT. He was newer at the company I was at. His name's Joe Myron. And we were basically talking, and I'm like, yeah, nothing I'm doing is working. And he's like, I've been taking these PRI courses. I don't know if I fully understand it. Nothing you're doing is working. You just told me that. Can we try some stuff? I'm like, yeah, dude, I'm open, man. Like, whatever you think, like, let's just see. And we were on the table, and he started doing some like the manual therapy stuff to the rib cage. And I was like, dude, you know what? Like, I actually don't feel the pain in my leg anymore. My back still hurt, like all that kind of stuff. I don't want to paint the wrong picture, but I'm like, the pain's actually not in my leg anymore. So this is kind of interesting. Then we went through the typical algorithm everyone who learns PRI does: 90-90 hip lift, left adductor pull back, right glute max. And I'm like, dude, actually, like, I feel a lot better. Like my back's still a little stiff, but I can like move. Like there's something here. And then we kind of just like progressively got me better, and like that all went away. But that will say like lit a curiosity in my brain. I'm like, I got to understand this a little bit better, because I don't really know if I fully understand what the hell just happened over the past however many sessions. And things got better. I took a lot of their courses. I started taking a lot of DNS courses too. I really like a lot of their stuff. They're from an exercise standpoint. The other stuff I'm not so sure on, but there's a lot of value in like all these different things. So I just went full send taking continuing education, and it got to a point where it was a little overwhelming. I'm like, okay, I'm learning a lot, but I'm also not sure I'm confident in how I'm applying some of this information. So like there had to be like a little self-awareness there, right? Like where I had to sit back and it's like, it's not this continuing education company's fault. It's like I kind of taken on a lot, and I got to really spend some time with this stuff and figure shit out. Mm-hmm. So I did that. I just kind of sat down, like, what are like some of the core concepts that these people are all talking about? Like I can get behind it. Like everyone's extended. Okay, cool. What does that mean? So then I start to like, unwrap this a little bit. Like I have a hard time getting behind the everything is neurology aspect. It's like when people is like everything at the cellular level, it's like, yeah, dude, everything happens at the cellular level. Like, what does that mean? Right. So it's like that, this is like a little woo woo for me, but it's like, what does this mean from like a biomechanics standpoint? Okay, I can understand this now. Like this actually makes a lot of sense. We need to be able to pronate and supinate. We need to be able to flex and extend, like from the most basic level. And then you can start seeing some of the similarities in a lot of things. And then what really got me into Bill Hartman's work, I actually met him at a PRI course in like 2015 or 16. But what got me into his work was really, for whatever reason, some of the stuff he said early on helped me bridge a lot of gaps between what I was learned from other continuing education and like even when I learned in PT school, like manual therapy application, like what am I actually doing with that? Because it doesn't make sense to me like, oh, this area hurts, let me rub it. It's like there's got to be an underlying reason behind why when I do manual therapy, sometimes it helps and sometimes it doesn't. Like relieving posterior lower compression, that actually makes a lot of sense to me, because that's maybe a driver for why someone doesn't have, is experiencing what they're experiencing or whatever it might be.
Yep.
So he's kind of the person who helped me like connect a lot of dots, I would say. Yeah, I don't know. I can keep going on this subject. So like, I think there's essentially what I was going to say is like, there's a lot of value in like, sitting down. Like I'm someone who very much thinks that like everything that I perceive in this world is me, right? So if someone triggers me, it's like really my response to what they're saying. So I have to understand that. They might be an asshole and that could be true, but it's also probably some belief I have where I'm like, all right, maybe I got to work through that a little bit. So when I think of continuing education, it's very much the same. It's the same for me. It's like, how does this now fit? How can I keep building on the model that I have in the way that I think about things? I think that clarity and definitions is important, like all of that kind of stuff. Because I think a lot of things gets lost in translation, and people interpret things to mean like they interpret compression a certain way, right? They interpret relative motion or orientation a certain way. And like they're just terms that mean something. Like that's it. That's all how I think about them. It's not like a bad or good thing, So, I think that's where a lot of some of this kind of confusion stems from.
Absolutely. I mean, one of the concepts, if I coach an athlete, what I say isn't always what they hear. But this happens clinician to clinician or coach to coach as well, where I think it drives a lot of confusion, dissent, discomfort maybe. So I totally appreciate what you're saying. Is that making sense?
Yeah, 100%. I was going to ask if what I said made sense. Like I just started going. I forgot the original question.
Yeah. Who knows? I mean, I think you offer a lot of good insight there because, we take these courses, we learn the algorithm, we try to apply it. It doesn't work, but very few people I think are willing to step back and try to unpack it, because at one point, we all went to the PRI course. That seems to be everybody's entry point for this. So a lot of credit to PRI for their influence. We go to the course, we see James do some amazing stuff. We're like, dang, how'd he do that? I go home and try it. It's bullshit. The only benefit anyone got from it was whoever I bought balloons from on Amazon made a sale, So instead of saying, okay, well, like, what's the difference between what he did and where I'm at, and what's that gap in knowledge, and how do I start to peel this back and find the fundamental principles behind this? Can I actually go forward? And instead, I think where most people tend to gravitate is, I'm just going to find the next thing, right? PRI didn't work. Now I'm going to do range of strength or FRC, or what's the one that does the cars, rails, pails?
I think it's FRC. Could be wrong though, but yeah.
I'm not training that. No disrespect to them. It's not where I'm going with it. It's just, we kind of jump from thing to thing, and there's probably some universal truths across all of these. A lot of these systems get results for various reasons. One of the things I found with this like compression expansion model is, to me, it casts the biggest umbrella in terms of accounting for things that we see, right? Like there's certain things within PRI where it's like, this doesn't fit in the algorithm. There's certain things maybe with, FRC where it's like, this one's kind of, we can't really account for this nuance. This model seems to just cover more things, not all things, just more. But I think getting to that level requires just a ton of work that I think many people are unwilling to do, or to put the effort in.
Yeah, there's definitely, I think, a component of that, or maybe just not, appreciating that the level of, like what it entails, right? To like continuously just send it, trying to understand stuff. And something you said made me think about, there's a conversation I had recently with someone who got mad at something I said, but they basically were like, how did it phrase? Basically, like they were talking about like 90-90, like the breathing drill, and how it's like the end all be all. And I'm like, no, you're thinking about the times that it does work. What about the times that it didn't work for you? Because those are probably more useful for you to learn from than saying that like, I'm just going to do this with everyone and ignore all the shit that didn't work. Because that's where your learning is going to happen. And it's like, dude, that's like, I screwed up so many times. And like, what did I do? I didn't just blame the exercise or PRI. I'm like, all right, there's some knowledge gap that I don't have. And like, let me just figure that out. Or maybe, maybe this shit's just not for me right now. I don't know. But like, I think having that component of things and just accepting that, like there's gray in what we do. We're not going to always hit a home run, is part of the process.
The easy thing would be for everyone to just arrive at like the Mount Rushmore of exercises, 90-90 hip lift, right side lying pull back. And instead, I think to your point, it's, we're not looking for an absolute truth. Like there's not going to be an exercise that works every time in every scenario for every person. Saying it out loud is kind of fairly obvious. Yet I think in application, sometimes we just really look to these to kind of save us because we're not willing to, do some work in and really figure out what the nuance is here.
Yeah, for sure. And it's just funny. Like it's making me think about just stuff like that's happened. So, for example, like I've had people reach out to me and they're like, "I wish I reached out sooner." But I'm like, okay, well, why didn't you? Oh, well, so and so told me you're a PRI person. I'm like, all right, cool. What does that mean? Like, what is a PRI person? Please let me know because I want to know if that is what I am. And then like they give like, oh, actually, I don't really know. Like, you're going to focus on things that don't matter. It's like, that's not really like a fair thing, right? Like, this is someone's projection, and now it's like affecting me and affecting you, right? So like, it's just like having that awareness. Like, you need like a little bit of a bullshit detector, right? Because you got to like kind of know where the information is coming from and what people are saying. So when people throw stuff like that out into the world, like it does become problematic because people have an idea in their mind of what a PRI person does, what a Bill person does. I've been called a Bill disciple. That's another one. I'm like, oh, tell me more. Tell me more about myself. What is a Bill disciple? Yeah, let me hear this one. Yeah, I'm like, what is this? I'm like, no, like this is not a thing, right? It's just like I'm someone who's curious. I'm going to learn from a lot of people, and I'm just trying to figure shit out so I can help the people I work with. That's literally how I approach things. I'm not married to to anything. So
Yeah, Bill has more disciples than Jesus, I think. That's crazy. Well, man, we've been going a while here, so I do want to ask you one final question. It's kind of off the beaten track from a lot of the conversation we've had today. We covered some great ground, so I've really enjoyed this conversation. But obviously, you run a clinic, which with that comes building a team. And when I watch you, especially you and Mo, I consider you guys like you're like the Nick Fury of building a PT clinics, because you have to find really awesome clinicians to fit into what you guys do. And I told you about my struggles off air prior to this of hiring a coach who's competent, effective, willing to learn. I mean, these are some of the intangibles. They have nothing to do with their actual coaching skill set, because you can teach people knowledge. But anyway, one question will never ever do this justice, but I'd love for you just some insight on building, developing, and cultivating a powerhouse team.
I really, first of all, I appreciate that because Monica and I work very hard on that aspect of things, and I think we may have said this. I don't know if it was off air or on here, but like I really think a lot of like the leadership side of things comes top down, and we have to be good at essentially managing ourselves before we can start managing others and leading by example, right? It's like if I'm telling people you got to be on time to this meeting and I'm coming 5 minutes late, like I'm kind of a jerk and I can't really get mad at them for coming late kind of thing, and it's like our core values, right? Like what are our core values as a company that kind of helps guide the process for us. So when we're interviewing people and we're, like potential talent and all that kind of stuff, like it helps us make a decent decision, like whether they're the right fit for what we're doing in our culture and what we're trying to put out. And I think from like a leadership standpoint, like I don't think it's different than like any coach I've had growing up, or like, right, you're the athletes you work with, like you're like a leader to them and they're going to listen to you and they trust you. So making sure that we have an environment where our team feels comfortable speaking up on a team meeting, like something they don't maybe agree with or like they don't have clarity on, like let us know, like literally just tell us so that we can make sure we're all on the same page, kind of thing. So that's something that we focus heavily on, and a skill that I'm trying to kind of like hone and figure out if I even have it or not. But it's like really like recognizing talent in people and helping to pull it out of them a little bit, and I have someone who helps me with the mentorship. I don't think he'll mind me saying this, like Encore. He is someone who I met. He was very green in the industry. Like I don't even know. He was very new to it, and he would just ask me a lot of questions in the DMs. And then he's like, I'm gonna join your mentorship program, but like, can we work something out? Because I live in India and literally third world currency versus US dollar. Like I just literally can't pay for that. So we worked something out. And now he's an employee for the mentorship program. And he had a lot of these traits, right? Where he's just hungry. He was doing it for the right reasons. Like he's like, I want to be the best in a country that has billions of people because there's this problem and I want to be able to solve it for people. I'm like, you can't train that, right? That's a quality that a person has, right? It's just like the athlete who's willing to listen to what you say and like they're going to do whatever the fuck you tell them because they want to be the best. Like those are just qualities some people just need to get pulled out of them, but you don't train it, right? They're there.
Yeah.
So it's like finding that in people. We've been very fortunate. I think Monica and I tend to attract, good people. Like I don't want to like downplay like what the work we've put into things. I think there's a component of that as well, and then it's just putting the plan in action and then hoping people are one of our core values, right, is, learn and grow daily. So we tend to attract people who are very comfortable with that mindset and knowing that when we have a problem in the business, we're going to put something in, address it, and then move forward. Like that's it. So I think it's like a combination of a lot of those types of things is kind of where my head goes with that question now.
Super valuable, man. I think one of the biggest insights and perhaps reminders from the entirety of our conversation is to just remember the human element of what we do and to be open to curiosity and just continuing to ask questions. I think most people are willing to, once you sit down and talk to somebody face to face or even through DMs, right? You're sending stuff back and forth. You can there's just a level of that human element to ask honest questions and be curious instead of, just positioning yourself with some kind of default stance that maybe shuts off lines of communication.
Yeah, 100%. And it's like, I use this in my marketing all the time as like the troll comments I get, just because I'm like, they're so ridiculous, but they're that, right? It's like, what is your goal with this comment? It's to make yourself feel better for 5 seconds. You're not trying to have a conversation. You're not trying to learn. You're not trying to understand my perspective at all. Like, this is just like you being a dick because it's going to make you laugh for 5 seconds and you can share it with your friends. That's all it is. Right. So like I use it for marketing because I think it's, whatever, gets my points across, but it's very true, right? Like if you just have a conversation with most people, like there's probably a lot of commonalities in what we think, and our goals are usually pretty similar. Like we're in a pretty niche area of the fitness industry. We're not in the I don't want to say like names, but there are a lot of big accounts that are like, right, like Booty Blaster, like 6 Minute Ad, like all that kind of stuff, very real. Like I don't even see that, but that exists, and that's what people have exposure to. So we're in a group of people who like really give a shit about what they do, right? So it's like that's the baseline. Like, what are we arguing about? Like we all have the same goal ultimately, right? So just open up the dialogue and, see what we can learn.
Well, what's next for Shaun and your multiple businesses training? Like what's next for you, man?
That's great. The training is an easy one. I got a half coming up in end of September that we're going for lifetime PR on. So we'll see how that goes.
What's the target?
140 is the target. So we'll see.
Wow.
We'll see, man. Yeah, we'll see. Yeah. I'm pulling out all the stops, man. I even got the super shoes lined up. I'm ready to go, man. I'm anything I can put in my favor. I'm bringing it in. Just get some Pacers, man. Like I should do that, but
so you locked in.
Locked in, man. Yeah. I love training though. I love having a goal and being able to push myself physically. Like it's something I took for granted growing up, and we talked about the injury, so it's something that I'm very grateful that I'm able to do now. So like I don't take that lightly. And trial and error with it too, man. I learn a lot about what our clients experience from just doing shit myself, so very useful. What's next in the business? We're hiring a full-time performance physical therapist. So if anyone's listening who is curious about what we do at AMP, I would love to sit down and have a conversation with you because it might be a great fit, and you could join our team. We have the mentorship. We have a webinar that we are hosting next Friday, August 23rd. Not sure when this is going to post. And that's usually how we launch our next actual mentorship program and Blueprint. That's going to be starting September 9th. So happy to have conversations around that as well.
Wait, I think I'm going to be a part of this cohort. So
nice,
I'm
man.
looking forward to it. Yeah.
We actually bought in sorry, man. Yeah, I say we bought on a strength and conditioning coach to join our team for this next one here.
That's exciting.
She'll be a great asset to, kind of what we talked about a little briefly, like bridging that. I hate saying bridging the gap. It's kind of like a buzzword, but like bringing it up from the rehab to the training side of things. Cause there's like that scalability is very valuable, and a lot of PTs don't have it, right? And a lot of strength coaches don't have the other way, So I'm not saying they have to be able to do both, but like being able to take a person further in one direction, I think has a lot of value. So I'm pretty excited for that.
It's like the USA track team. Like you got to practice handing off the baton. There's some middle ground there.
Yeah, 100%. Yeah, the goal is not to make a strength coach a PT, so I don't want to paint the wrong picture, or to make a PT a strength coach. But it's like I need to have common language, and I need to understand these principles and how they apply, so that I can have a conversation with someone else who's working with the same client. Where we can ultimately end goal is them, right, and their goals. So if we can better that process, then we're doing pretty good.
Yeah, we usually live in our little silos. I mean, some of the most of the PTs in our area are part of these big networks, right? So they're kind of handcuffed to the system. And there's one out of, I don't know how many that we can actually have communication and a conversation with. We can go back and forth. And the quality of care is just that much better because of communication.
Yeah, dude, it's tough, man. And I take for granted our relationship that we have with the coaches at Bolt because we're right there. But it's like, dude, if I'm a strength coach, like, and I see, no offense, but like I see the shit that's out there from like the rehab standpoint, like it's brutal. How am I going to have confidence referring an athlete to a person who's going to tell them to, oh, well, you know what, that deadlift is probably why the reason your back hurts. Like, okay, sick. Like, I'm going to really send to this person, you know, like that doesn't help. But if we can have these conversations and have, I say like-minded in the sense that like, not that we think the exact same way, but that we at least appreciate the end goal. And we are trying to bridge the gap to get the person from point A to point B. Like that's the only way we can move forward and really help people to the best of our capability, in my opinion.
It's a real pain point for me because a lot of these larger, like hospital-oriented physical therapy clinics, they just it's formulaic, right? If you have a knee problem, you get the knee program. Doesn't matter what the knee problem is, you just get the knee program. And so I kind of am facetious with some of the athletes, but you know, they'll bring in their paper printout and they're like, well, we need to do these things. I'm like, oh, so, you know, the quads are tight and the hamstrings are tight, but they're also weak. So we're just stretching and training everything.
You're asking too many questions.
Okay. I'm like, wow, like we're just going to throw everything at the wall and see what sticks. I'm like, it just, you know,
don't move.
Nonsense.
Yeah,
So,
man, it's a real thing. This is another topic I could go in on, but I know we're wrapping up. So
another time, man, we'll have you back on, man. It's been a huge honor. Thank you again for carving time. I appreciate this. This was a really fun conversation, and I will get this out before your webinar. So hopefully we can get people listening to this and signed up for that. But is there anything else, final thoughts you want to leave with? Just sign up for the webinar. Where can we find you on social media?
Yeah, first, thank you for having me. I really appreciate it, man. So social media is the best place. Instagram. Let me see if I know my handle. It's Dr. Shaun Astorga. I think it's Dr. Shaun Astorga. ShaunAstorga. I don't know. Good luck remembering all that. But yeah. That's the best way to find
I'll put it in the show notes.
You can fact check me on that too. I probably got it all wrong.
All right, man. Well, take care.
All right, man. I'll talk to you soon.
If you enjoyed this episode, please remember to rate and review us with 5 stars only. Then subscribe so you can get all the latest updates.